So I thought your comments were interesting, and I would respond to them with a few extra points about breast reduction and coverage and the amount of tissue that we remove. So the first thing is it is actually a range. So they have a Schnur scale number, but if you're a little bit off from that number, like 10, even 15%, I've typically still had surgeries covered, even if I'm a little bit off from the Schnur scale. Now, the one thing I see a lot in the breast reduction patients that I have come in is that they've seen other doctors and they've had their surgery pre-authorized elsewhere, but it's not a surgery that's ever going to be covered. And so, unfortunately, what happens is that a plastic surgeon will send a pre-authorization. The number they put is what matches the Schnur scale, so it gets pre-authorized, but that number was never something that was able to be done. And then the patient ends up getting billed on the back end, which is really unethical and bad, and I unfortunately see that happen a lot. So if you have a surgery that's pre-authorized and then insurance won't pay for it afterwards, even with all the stupid wrangling they usually make us do, it's often because you're really far off from whatever the Schnur number is that they wanted. And in general, it's pretty easy for most patients to prevent that. So it's not just all a guess. There's a little bit of science and experience to determining how much tissue we're going to remove. So the first thing is that I always use as an example to patients is a soda pop can. So this is 355 mLs. And this equates to about 355 grams of tissue. So you can hold this up to yourself and go, can I remove this much, if this is what the Schnur scale wants for that particular patient? And if it's clear you can, then yeah, you probably can do it. And if there's no way, then yeah, you probably can't do it. The other thing we have that's a more objective way to gauge volume is I use a Vectra 3D imaging system. So I can take an image of my patient and it will give me a volume estimation of their breast. And so I can look at their breast, I can look at what their goal size is, and then I can look at the Schnur scale and figure out, hey, can I do it? So if my patient has an 800-gram breast and they would like to be a C cup afterwards, but their insurer wants 600 grams, that's not going to happen because a cup size is usually 150 to 200 grams. So a C cup is going to be 450 to 600 grams. And if they want 600 grams from an 800-gram breast, that would leave 200 behind, which is barely an A cup. So you can just do the quick math and tell your patient, hey, this isn't going to happen. The reality is that we can get things covered and pre-authorized if we meet that criteria, but it may not be what the patient wants or even what's actually possible based off of how much tissue we have to leave behind. So I hope that answers a little bit of the questions about how we do this. I know it sounds like super random and scary that maybe insurers won't cover it, but an experienced plastic surgeon who does lots of reductions, that's not something that typically happens because we know how to figure this stuff out. And it's not an exact science, but the more you do, you get pretty good at it.